All right, y'all, in this video, we're gonna be going over CARs, PAILs, rails, explanation, and a little bit of a demonstration, all right? So if this is all new information for you, this is going to be a lot of information to receive and digest at first. Don't get worried, don't get lost in the potential overwhelm of the amount of new information I'm giving you. If you practice this and if you just continue to watch the videos and practice this daily, the philosophy and the concepts and the approach and the execution of CARs, PAILs, rails will come naturally and become second nature. And it really doesn't take that long. On average, I would say it takes my clients 5 to 10 days of consistent effort before it just starts to click and become much, much easier to understand. So again, just be patient with yourself, try and pay attention. Please do not skip this video. It is very important and is the foundation of pretty much everything that we're going to be doing together under the lens of mobility training. So let's start with CARs. Stands for Controlled Articulated Rotations. So when we do CARs, it's doing a number of things. We are first and foremost warming up that joint or that part of the body. We are assessing where we may be stuck. It's an assessment tool for me as a practitioner to kind of see where you may be limited, or my clients, any client really. But it's also an assessment for yourself to see how your joint is feeling that day before your workout or just in general. It's also used as a tool to communicate with the nervous system. So in a sense, your nervous system is communicating with you and you are communicating with it. That being said, what I mean by that is as I go through a shoulder CAR, if I feel pain and restriction going from external rotation in the flex position to internal rotation, that's just information for me that my body is telling me is a position to be avoided essentially, or worked on. It is used as a tool to communicate with your nervous system as well to say, hey, this is a safe place for me to move and this is my new end range, and that comes after doing a set of PAILs rails. So moving on to PAILs rails, PAILs / rails. That stands for Progressive Angular Isometric Loading, Regressive Angle Isometric Loading, not angular angle. Progressive, regressive. This is really the only difference between the two, PAILs and rails. So CARs come first to warm up the joint. PAILs, rails are used to activate the area, but also to create new end range, especially in positions where we may be stuck and or weak. It's also a tool that can be used for strengthening, raw strength or endurance in our end ranges. And the idea behind this is what's said in FRC often is we can't move where we can't move, right? So we can't increase our mobility in positions where mobility isn't increased. So we use PAILs rails to put a joint in a particular, say, internal rotation of the shoulder. We put ourselves into our absolute end range of internal rotation. We hang out there. So this is the setup, is going into our end range in a position, shoulder internal rotation. Once I'm in my end range and I feel a 7, 8 out of 10 stretch, we hang out there for ideally 2 minutes. It's a very difficult thing to do for most people, especially starting out. So I usually say 1 to 2 minutes. When I've done 1 minute consistently before in the past, I've gotten results. Clinically speaking, we hold a position or we hold, say, foam rolling. We are approaching soft tissue for 2 minutes, and clinically it's been shown that that 2 minute mark is what yields the highest level of adaptability of the tissue, before getting diminishing returns, right? So we get into a stretched position, feel an 8 out of 10. We'll use shoulder flexion as an example, all right? So I'll be in shoulder flexion. Where you should feel a stretch is this right here. It's the open angle. It's the progressive side. So where you feel the stretch in a position is the progressive angle, right? So that means this angle is progressed. The regressive angle is the side, the angle, all the tissue that's getting pulled together, right? And it is a passive stretch. So this is the regressive side. This is the progressive side. That's going to be more important here in a second. So what we do is we hold this position. Usually you'd have a dowel. There's a lot of different ways to get into shoulder flexion, PAILs, rails. So pretend I'm holding a dowel. I come into shoulder flexion. I feel stretch through here, 8 out of 10. Hold that for 2 minutes. After holding that for 2 minutes, we PAILs. So we ramp up. Just put a little arrow, ramp up from 10% to 20%, all the way up to 100% progressive angle engagement. PAILs, right? So the progressive side, the tissue is going to engage at 10%, 20% effort, 30% effort. And then what that looks like is that since I'm in shoulder flexion, that means I'm trying to extend my shoulder down isometrically. That's what the I is for. So if I have a dowel and I'm here and I feel a stretch here, I press the dowel down isometrically though. My arm isn't actually moving. I am just pressing down, lat lights up. So I stay in this position for 2 minutes. Lat is engaged to mimic this, but the dowel is here and I'm hanging onto it and I'm squeezing it so that it's engaged isometrically. My joint isn't moving. No other body part is moving. I'm engaging by pulling a 10% effort, this driving down into the ground, 20% effort, 30%, 40, 50% effort, 60% effort, 70, 80, 90, 100% safest max effort. I'm pulling down with my lat muscles down into the ground as hard as I can, 100% safest max effort. So what that means and why that's important is that we say safest max effort. Generally speaking, you're going to be able to give 100% max effort. If you're dealing with an injury, if you're being put in a position that doesn't have a lot of neurological connection, say a lot of people in the foot and ankle, or anywhere, any part of their body, you may engage at 40% effort and feel like that's your 100% for the day. Or again, if you're dealing with pain, you start reaching 40%, 50% effort, and it starts to flare up your pain point and you feel unsafe to go any harder. That 50% is your 100% effort. But generally speaking, we're able to pull down at 100% effort or engage that PAILs at 100% effort. We hold that engagement for 15 seconds. I say 10 to 15 seconds, but really try and pull as hard as you can for 15 seconds. Again, without any other part moving, we maintain the position we start in, ramp up to 100% effort, maintain that for 15 seconds. That's pulling in. And then we flip it, after that 15-second isometric engagement, we flip it into our rails, right? So we're here. If this is our PAILs, where's the regressive angle? What is our rails? Our rails is this up here. This portion, this angle of the joint is getting shorter and smaller, right? So what that means is that if we just PAILs, hold for 15 seconds, and then we flip it immediately to 100% rails, what does that mean? That means we go from this to 100% effort straight up as hard as we can, right? So you can hang on to the dowel, that's fine. If it's an immovable object, if it's a pole, what you would do is lightly let go, rails, shoulder extension as hard as you can, and then maybe grab on or don't. And if you're hanging on, just pull up as hard as you can for 15, 14, 3, 2, 1. Relax, lean deeper into that new end range, and come on out. So, PAILs, we ramp up from 10%, 20, 30, 40, all the way up to 100% effort, and then we immediately flip it into the rails 100% effort. We don't have to ramp up when we go from PAILs to rails. We ramp up to PAILs, and then we flip it immediately into rails 100% effort, holding for 15 seconds as well. Now, if I haven't mentioned this already, or if I am repeating myself, please forgive me, but it's worth repeating, is that two things. One, when we engage, so once we get into the passive stretch for 1 to 2 minutes, when we engage into our PAILs rails, nothing is supposed to move. It's isometric, right? And that also means as we're ramping up that I'm not going from 50, 60 to 70% while coming up or rotating. No other part of the body, no other joint should be moving except for the joint that you're targeting. That goes for PAILs, rails, and cars. When we're moving, we're only targeting that one joint and trying to not compensate. Say I do a shoulder car, I'm not trying to compensate through my elbow or wrist or torso. Everything stays still. And we will review that again later. So we warm up, assess with the cars, we hold our stretch, we ramp up to PAILs, we flip it 100% to rails, holding for 15 seconds each, right? After we do a rails, we follow it up with a car generally. So this is what I call bookending the PAILs rails with your cars, all right? So this comes back to communicating, using cars as a communication tool to your nervous system. Doing a PAILs rails increases capacity, it increases strength, but it also increases our range of motion. And again, that's another way of saying capacity, right? It increases our joint to create new degrees of range of motion. So now that the shoulder is opened up, say we've got great internal rotation, external rotation, extension, and we're missing quite a bit of shoulder flexion. We only do the shoulder flexion PAILs rails each day or before each upper body workout. Now we tell and show our body and communicate with our nervous system, hey, before I did this PAILs rails, I was here. Now I'm here safely without pain. And that's just another layer of communicating with the nervous system to get out of pain, to stay out of pain, and to have better mobility. So to review, start with cars, do your PAILs rails, end with cars, bookend all of your PAILs rails with cars, all right? A quick note on that is that say I'm missing shoulder flexion, internal rotation, and extension. That doesn't mean that I do a shoulder car and then internal rotation, car, shoulder flexion, car, extension, car. If you're targeting PAILs rails, multiple angles of PAILs rails on the same joint, just do that one joint car, do all the PAILs rails, do that joint car. So it doesn't have to be after every single rep, just after every targeted joint, all right? When it comes to pain, when it comes to what you should be feeling during a cars PAILs rail, so we'll start with cars. Say I do a neck car, right? I'll just show real quick. There's gonna be a separate video on going through all of these cars and PAILs rails. But if I'm going through a neck car, I am making a big circle with my head. It's a more intentional neck roll, if you will, that we did in gym class, right? But it's just more refined, if you will. So from a bird's eye view, I'm essentially trying to do that, right? Now, this is the person's nose, ears, back of the head, right? Neck car. Most people who have pain in their neck, generally speaking, they're gonna be in the back right and the back and or the back left vector. Kind of, people will say trap, it's more than likely the levator or the splenius capitis, whatever. What's important to know is that, say I'm going in this direction, so for me, that's this way, and I feel pain here in the back. For me, it's my back right, and for the demonstration, back right. The thought process for most people would be to just kind of push through the pain slower and just like bear it and grit it. So they would be here, and then they might tense up, and they might just like move through it and just be like, all right, well, we're gonna do it anyway. It is FRC's philosophy that in those situations, we actually work around the pain. So instead of pushing through it, we would again start here, come this direction, say we feel pain here in the back right. As we know we are approaching a place where we feel pain, we pause and we work around the pain, close to it, and then finish out the cars as needed. All right, so what that would look like for me, I guess I'll just face this direction and say the pain is back here. I start coming up to a spot where I know I have pain. Instead of pushing through it, I would pause, go up and around that pain point, and then finish the car all the way through. Or going the other direction, same spot. If I know there's a pain point there, instead of pushing through it, I would just come up and around, move around, and then finish out my car. All right, so don't push through it, work around it. Having a pain point for your pails and rails, this is very, very, very important. Please pay attention. And again, this will be reiterated throughout other videos, but we'll use shoulder flexion again as an example. Say you're dealing with shoulder impingement, shoulder issues, and you know that pails rails can help because you need to increase range of motion in order to get out of pain. The goal of pails rails is that, say I have lateral shoulder pain and I come into shoulder flexion and it feels really good. Again, where should I feel a stretch and where should I feel sensation? On the progressive side, this thing that's being stretched out. Where I shouldn't feel pain, where I shouldn't feel sensation is on the regressive side. If the angle is regressing and the muscle is coming together and the tissue is coming together and you feel pain in there, that can actually be indicative of soft tissue damage. It can be indicative of just an actual legitimate injury. That's nothing to be worried about. It's just something to be mindful of, and that's okay. So if we're here in shoulder flexion and you feel the stretch on the progressive side, which you should, or a deep sensation, that's fine, and you feel pain up here, going through a pails rails with that pain sensation there, even if it's a 1 out of 10, is something we need to avoid. It can exacerbate the issue, it can make it much worse, right? So we'll use the neck as an example again. So if there's pain back here, if I come into this position, what is the progressive side? Here, this is the progressive side. I should feel a stretch here, not any pain up here. So if I know there's a tender area back here that kind of hurts, and I come here and I feel that area be stretched out and it feels safe, totally fine. If I come back and around, and not to say that, well, yeah, I guess you definitely could do a pails rails here. Say for whatever reason we're doing a pails rails here in this position, and I feel pain here. What's the progressive side? What's the regressive side? Progressive, what's being stretched? Regressive, what's being shortened? So would I pails rails this? Absolutely not. It's only gonna make it worse, all right? So yeah, that should do it. To recap, start with cars, move nice and slow. The slower you go, the better. And when you're moving through it, you're not moving any other joint. You're only trying to isolate that one joint. That's one of the coolest things about FRC. That's something that really blew my mind, is that if you try and go into shoulder flexion, and in order to go into fully expressed shoulder flexion, you also lean back and rotate. You don't have a shoulder joint, you have a shoulder thoracic spine, more thoracic spine joint, right? So you have to be, the whole point of all of this is being able to move independently, one joint at a time through its full range of motion without pain or compensation or stuckness, right? Pails rails creates more space within the joint and builds resilience and strength and capacity, all those things. We hold a position, we hold a stretch for passively for up 1 to 2 minutes. After that 1 to 2 minutes, we ramp up from 10%, 20%, all the way up to 100% effort. We maintain that 100% effort for 15 seconds. After 15 seconds, we flip it into our rails, 100% effort, the opposite direction, so long as there's no pain in the regressive tissue. Hold that for 15 seconds, lean into the new space passively, follow it up with that joint car. And essentially that's how we'll be starting nearly every single workout, is cars, pails rails, some light body weight movement maybe to activate and deepen the stretches on a deeper level, and then jumping straight into our workout. All right.